Yeah. Okay, ladies and gentlemen, we are about to begin. Before starting, I will convey a few things that need attention. Please be seated in front of your computers or gadgets. It's a good idea to keep the camera open during the event. If you're not talking, commenting, or presenting, please keep your microphone mute. And if it's your turn to talk, be sure to unmute your microphone first. When you are finished speaking, mute your microphone again so you don't cause a distraction for the next person who speaks. Please don't make noise during the event, and please keep politeness during the lecture. For participants who want to ask, please write a question in the chat box, or if you want to ask directly in the Q&A session, please press the raise hand emoticon first. Thank you for your kind cooperative and attention.
Yeah, good morning. Can I share screen from my side so I could control it? Would you allow me to do it?
Yeah, okay. Pak Opal, tolong jadikan co-host Prof for my presentation.
Yeah, okay, please, because I am still disabled.
Yeah, okay.
Yeah.
Okay.
How are you, Prof? Is it good today?
Great. Yeah, great. I just try to really do the first. No, it's very hard to go up. Okay, thank you. So thank you very much for inviting me. So I hope you know that I'm Wongsa Laohasiriwong. I'm the Dean of the Faculty of Public Health. So I will share with you what is happened in Thailand and what we plan for the next, or what is still existing in Thailand and what we really plan. Yeah.
So, I'm sorry, Prof.
Yeah.
I'm sorry, Prof.
Yeah.
Can we open first with the MC,
okay.
maybe?
Yeah. Okay. Yeah. Thank you.
I'm sorry, Prof.
Sorry. Yeah, I'm sorry, Prof. Okay.
Yeah, thank you very much. Yeah.
Okay, allow me to be master of ceremony today.
Yeah. Okay. Thank you.
Baik, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh. Sawadee krap. Good morning, everyone. Her Excellency, the Dean of Public Health Faculty of Kalimantan Islamic University, Ibu Melia Farika Indah, SKM MSc. The Honorable Expert Lecturer, the Dean of Public Health Faculty of Kaen University, Professor Dr. Wongsa Laohasiriwong. Respectable Lecturer, Public Health Faculty of Muhammadiyah University of East Kalimantan, Mr. Purwo Setio Nugroho, SKM MEPIT. Honorable leaders and all lecturers at the Faculty of Public Health of Kalimantan Islamic University, our dear students and respectable all participants of this international expert lecture. First of all, let's thank the Almighty Allah Subhanahu wa Ta'ala, who has given us some mercies and blessings so that we can attend this agenda without any troubles. Secondly, salawat and salam may always be given to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness to the lightness. Allow me to introduce myself. I am Ahmad Zaki Anwari, will be your master ceremony this morning. Ladies and gentlemen, all the guests and audiences, I would like to say, welcome to the International Expert Lecture Public Health Faculty of Kalimantan Islamic University 2023 by the theme Global Public Health Post-COVID-19 Pandemic Learn Lesson from Thailand. Thank you very much for attending our invitation. Ladies and gentlemen, on this occasion, allow me to read you today's agenda. First is opening, and then welcoming speech, the third presentation by the guest lecturer, including question and answer segment, and for closing. Distinguished guests, ladies and gentlemen, for our first agenda, let's open this expert lecture by reciting Basmalah together. Next agenda will be a welcoming speech. Allow me to invite the Dean of Public Health Faculty of Kalimantan Islamic University to deliver her welcome remark, and at the same time will open the expert lecture event this morning. To Ibu Melia Farika Indah, SKM MSc, your time and opportunity are welcome.
Okay, thank you, Pak Jaki. Can the voice is okay?
Yes, ma'am.
Ya, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. The Honorable, our guest lecturer, Professor Wongsa Laohasiriwong, the Honorable Mr. Purwo Setyonugroho, PhD student at Mahidol University, Thailand, and our dear lecturers of Public Health Faculty UNISKA, the beloved students of Public Health Faculty who joined the program this moment. Alhamdulillah, praise to Allah who blesses us with health that we can participate in this expert lecture this morning. Prof. Wongsa, who will be our speaker today, is the Dean of the Faculty of Public Health, Khon Kaen University, Thailand. Good morning, Prof. It is an honor to have you here with us this morning. And also, Pak Purwo, we appreciate your assistance that make possible for this program to be conducted. And thank you for your willingness to be the moderators. One of the positive lessons from the COVID-19 pandemic is that it required us to learn and use online platform communication technology, such as Zoom that we are using at this moment. This platform allows us to communicate directly with others from faraway region from us. This moment, it allows us to meet Prof. Wongsa and learn directly from her. This program is also to fulfill vision and mission of Public Health Faculty UNISKA, which is to develop cooperation and networking with universities in Asian countries. My appreciation and gratitude for Prof. Wongsa Laohasiriwong for her willingness to share her knowledge about lessons learned from Thailand, how the issues of public health problems during pandemic COVID-19. From the issue problems, we will learn about the global health in generally, especially related to public health. As we all know, COVID-19 pandemic has made us aware about the importance of public health education. It made us realize the importance of health workforce and their role in educating the community on the importance of preventive action compared to curative one. This shows that there is an increasing awareness on hygiene and health. In this lecture, we will be able to learn from our neighboring country, Thailand, and how Thailand reacts, respond, and anticipate the impact of COVID-19 on Thai people, what health issues that Thailand has to face in post-pandemic time, how to deal with emergency condition. May the knowledge and experience set by Prof. Wongsa will be beneficial for us. Let's us learn and keep our mind on the lecture. Hereby, with Bismillah, I declare expert lecture, Global Public Health Post-Pandemic COVID-19, Lesson Learned from Thailand, officially begin. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you very much for your delightful speech, man. Okay, ladies and gentlemen, now we proceed to the main event of this agenda, which will be guided by a great moderator, Mr. Purwo Setyonugroho. But before we start this main event, I would like to read his curriculum vitae. Okay, let me share the curriculum vitae of Mr. Purwo. Okay. Here they are. Our moderator name is Purwo Setyonugroho SKM MFIT. He lives or domicile in Thailand now. His mobile phone is 0857 36 36 26 26. He's a male, of course, and domicile now in Nakhon Pathom, Thailand. His marital status is married, and his religion Islam, and his occupation is docent or lecturer in Public Health University of Muhammadiyah, East Kalimantan. He is interested in epidemiology and then population biostatistics, social epidemiology, and non-communicable disease. and his education, and now he is still study in PhD degrees in applied demography and social research in Institute for Population and Social Research, Mahidol University, Thailand, from 2021 till now, and his master degree from Public Health Faculty of University Indonesia University, and his bachelor is from Muhammadiyah University, Solo or Surakarta. He has followed many seminar, training, and workshop, and then also made books and many article publication. There are many titles from his book or publication. I think that are his curriculum vitae. And then now, without wasting much time, I will fully give the opportunity to Mr. Purwo to lead this lecture, this expert lecture. So, Mr. Purwo, your time, please.
Okay, thank you, Master of Ceremony. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Okay, good morning, Ajahn Wongsa. This is our second time, Ajahn, to meet with you. Before I have met with you in the solo, Ajahn, when I study in bachelor degree with Mr. Nur Alis, Ajahn, in the 2014 maybe. Okay, now I am as moderator Ajahn in this KIS lecture, and hopefully we can meet in person, Ajahn, in Indonesia or in Thailand, Ajahn. It's very happy for me to meet with you, Ajahn. Okay, in our guest lecture, I will guide you in this case lecture, and I will try to translate, Ajahn, after you present. I will to translate in bahasa Indonesia after you present, and after you present I will try to if the participant have a question in bahasa, and I will help you to try translate in English, Ajahn. Right there, Ajahn. Okay, in this lecture, the lecture today is Professor Wongsa Laohasiriwong. I'm sorry if I spell your name. And she is the Dean, Faculty of Public Health, Khon University, and she is many experience to have collaborating with Indonesian University, in Muhammadiyah University, and private university and the public university in Indonesia. Many experience, and hopefully for next in the future and the next day and next month we can collaborating with the Islamic University is in Kalimantan, UNISKA today, Ajahn. And in this presentation, Ajahn Wongsa will present about the COVID-19 in the Thailand, and we can learn about how Thailand prevent the COVID-19. And now I give you for this lecture, Ajahn, to present your presentation, and time is yours, Ajahn. Please, Ajahn.
Okay. Selamat pagi.
Selamat pagi, Ajahn.
Sawadika.
Good morning, Sawadika.
Dear Dean Melia Parika Indah, the Vice Dean, the Administrator, Dr. Provo, all lecturer and students. So it is my great pleasure to accept the invitation to be guest speaker today. Actually, I have direct experiences with like COVID-19 management in Thailand, because one of my doctoral students is the deputy director of the Department of Health, Kromanamai in Thailand. So he's directly present to the Prime Minister every week about the situation based on the evidence, and we have analyzed it and presented for the think tank to manage it, and also in many things. Yeah. So may I start?
Yes, Ajahn, you can start, Ajahn, please.
Yeah. Okay. I will start. Just hold on. Okay, hopefully this is the one. So welcome to Thailand. I hope like many of you know Thailand. Like we are your neighbors, just like above Malaysia, and like it's a mainland, one of the biggest mainland country in terms of population, follow Vietnam's. And then like we have 4 regions: northeast, where Khon University is, and central, and the south. Sometimes they call the east, where Pattaya is. So you could see like our Grand Royal Palace and many things in the northeast, the central, north, south, which is like have the beaches and also some of our cultures. So we have only about 20 million, could not compare with your country, 220 million. So we are a very small country, and we really bow by Myanmar, Laos, Cambodia, Malaysia, and very close to what how you call this one, very close to Thailand, near Phuket, right?
Kamboja, Ajahn.
Yeah. So and then we have 79% of the people are the Thai, followed by Myanmar migrant, and also like about 95% of Buddhism, and we have about 4% of Muslim in the south, and also many, because this area play very important role during COVID, because the last wave of the COVID-19 is really very high incident in the southern part of Thailand, which is we could not really control the border with Malaysia. And then like Thailand is like almost absolute aging country already, because almost 20% of the population is older than 60 years old, include me. Include me. And we have very few younger age, right? So and about the working age now is almost 70%, which is we really happy with that, but we worried about the future because we could not live with the young population. You want to translate, or let me continue?
You
continue first, right? Or you translate?
Yeah, Ajahn, no, you can continue. Sorry,
Okay.
I will ask to this organizing committee. Bu Mei, saya langsung translate atau di akhir Bu Mei?
Nggak apa-apa, selesaikan aja dulu biar nanti disimpulkan aja.
Okay. Ajahn, you can present, finish, and after I will conclude, Ajahn, your presentation and try to deliver in bahasa, Ajahn. You can present until finish, Ajahn. Please, Ajahn. So
we have 77 province, include Bangkok. Bangkok is here, but so if you do not count Bangkok, we have 76, and Khon is here in the northeast, right? So and then this is the health system in Thailand, right? The health service. So in the primary care, you have health center, right? It used to be like this, but right now it's we call health promoting hospital, right? We used to be health center. After we have 30 baht skill, it promoted to be primary care unit, and then right now it's called sub-district or Tambon health promoting hospital. And then we have community hospital, like start from 10 or mostly 30 bed up to 120 bed. And we have general hospital, and it is big, it's called regional hospital. And also we have super tertiary, which is like a little bit bigger, but it's full equipped with everything. Is included in the Ministry of Public Health, and also Excellence Center, and also University Hospital, like the hospital in our university is like this. So this is the one that look after the service in the public sector, and some private is in these levels. So bring you back to the Thailand COVID-19 crisis. So the first case, I think Thailand is the first country outside China that could identify COVID-19 since 13th of January, because in Wuhan it's really late, right? Late 19, and then it starts spreading to Thailand first. And then at the beginning, Thailand is very good. So in Thailand, if you would like to see the pictures about how it spread in Thailand, this is the COVID incident rate per 100,000 population. We have first wave, second wave, third wave, fourth wave, and fifth wave. So the first wave is come to Bangkok, and some, you see that is the south, like close to Malaysia, and some near Laos. So it's the first wave. It's not hard to, the prevalence is not that high, the incident not that high. Second wave is still quite okay at the beginning, but after it changed the valence, we need vaccine. So this is mostly in the central, and this is nearby Myanmar with the migrant. So this one, and in the second wave, we could control the south very well, but the third wave is really kind of mostly central and the south, right? And also, and you know, the last one is really high in the south. So this is kind of like the overall pictures of Thailand. Like the case, we have total of 4.6 million. Like average lately in 2022, late 22, it's been late last year, we have about 1,000, almost 2,000 cases. The death total is about 32,000, not many, but it's average. And also vaccination, right? We have only 67, right? 70, more or less 70. So the first vaccination, first dose of vaccine is cover 57 million. And second is 53, but the third is about 31, because people are kind of like reluctant and whatsoever. You could see this one could give you very clear pictures of like how big with the fourth wave and fifth wave. And then like how Thailand approached the COVID-19. For sure, I think many of you are epidemiologists, right? What we do is like we identify what are the problem or what is the problem by surveillance. And after that, sure, you have to identify the cause. So list factors identification, right? Whether in any area that is overcrowded and really poor management, what worked is mean the intervention that we give, we did our evaluation, and for sure after that we kind of implement the program or project to control it. So from problem to the response. So this is the general management of epidemiology's issues. And then what are our priority, right? So this is the priority in Thailand. I think for sure is similar to Indonesia. The first one, the most important is preserve life and try to make mitigation of the spreading, and also the continuity of the government. So we try to control peace and order. So that's why we announced the curfews and many sorts of things. Peace and order is very important because people could be panics or against the government policy. And also the third one is important, is in Thailand, the government work very well. So the preservation of the system, not only in kind of really administration, is also commercial business, not for profit, and critical infrastructure that like public transport and many sort of things have to be operate. And the fourth one is crisis stabilization. How could we reduce and control the disease, the spread of the disease? This is very important. Because every day you could see the figures in the TVs and something to show how many cases today, blah, blah, blah. So it could cause disorders. And also transition to pre-incident condition. So this is very important. I try to do proactively prevention. And how could we get the kid back to school? Because like we have to like stop, learn from home, right? Study from home, and also get people back to work because we force them to work from home as well. This is very important. And you know that productivity during like this period is very low because we have to preserve life of the people, and also really prevent the spreading of the disease. And the other one is reducing the impact of vulnerable population, like the the area of congregation, right? Factory and the camp, the military camp, soldiers and military and police and any other, and senior, right? The elderly one, really high, really prevalence. It means high priority for us, and also geographical spot, like especially the border area, both international or cross borders of the land area. You want to translate, or I could continue?
You can continue, Ajahn, until finish. Is okay, Ajahn.
Yeah. Okay.
Yeah,
and then for sure, Thailand is the country with the, right now we are the highest destination for tourism. Right now we are the first one. Like second one is Paris. The third one is London. So Bangkok is like, we have more than 28 million visitors for sure. Before that, we also get these high numbers, but with the COVID, it have a lot of things, and people got panic. It affect us in many things. So the 6 challenges that Thailand facing is we have a lot of data from many sources, and it could be like really cause panics and misunderstanding. So multiple data integration is really kind of occurs. Treatment for vulnerable people such as laborers, people living in slum and in the internally displaced. So this is very important. We have a lot of migrant worker. We have a lot of worker in factory, and also like people have to migrate back from Bangkok to their hometown because Bangkok could not accommodate them, and also it's very hard to make for living because many factory closed. They could not earn for living. Preparedness in urban area and primary care. So in the very congested area in Bangkok, there are a lot of like mafia gangster that you could not really stop them from their activities, and you could not cross the area. So how could we do this? And also primary care, we have to have like how you call home isolation, right? And community isolation. So we have a lot of this issue that really challenging. Fatigue from coping with pandemic and citizen negligence. And not only people that have problem, we have public health personnel. So we also really, because many of them have to wear that, that protective, right, equipment, clothing, and work 24 hours a day, never come back home for more than 1 week or 2 weeks. Some of them stay at the office or the area for the whole month, right? And also the citizen, also some citizens, no matter what you do, they're still unaware of what you're doing. Like innovation development, this is the crisis to opportunity. You could see that in Indonesia. Also, you have a lot of application and many measures that is show the system itself, they show the function, they show so many things. And infectious waste management, like aside from laboratory. So for sure, from laboratory, you have a lot of waste. Like how could you like manage the test kit and many other things. And this is our strong point. So we got a lot of support from senior officials who are responsible of implementing policy. So not only we have the Prime Minister as the chairperson, we have minister of many ministry, the department, the director general of department of many. So there are so many work that they try to show what they could do. And also we have really strong public health system. This is one of the best, like because we at the beginning we are number 4 or 5 of the world that it show the competency in managing it, with more than 4 decades of investment in universal health coverage and primary care. So all 99.9% of Thai people got health insurance, and they get the service for free, vaccination free everything. If we and even delivery medicine to their home, and also free food and many things delivered to their home. Cooperation among various sectors such as government, private, public, and education. So we work together very well, and the committee themselves are very strong, especially with the village health volunteer that really are the grassroots of the, how you call that, working end of the public health process to encourage the participation of the citizen. So we get cooperation because we try to we call participatory public policy development. We invite all sectors, the monk and how you call religion leader, teacher, and many other sectors that try to help working at volunteer, donate a lot of food, shelter, and many things. Digital technology, innovation, and research. This is very good because before that we start doing already, but it's not really full scale. But with the COVID-19, it's threat, right? So that's why we have a lot of these things going on. So, and then how did we manage? How did we manage? I think you could compare to Indonesia. Through the Center of COVID-19 Situation Administration led by the Prime Minister, they have meeting every week, and maybe more than that, but they have to present the situation, what they have done, and the result, that sort of thing. And every meeting we got a lot of assignment, and after that we have other committee, also the part of the committee to represent the Faculty of Public Health in Thailand, and also talk and got assignment to help. And we have live TV daily briefing about the source of information, and delivery the information to make them have a single source and try to make them understand correctly. And then we have transparent, evidence-based, and easy to understand message, guideline, and information to ensure the trust and adherence. We try, because for sure, I think in Indonesia, you could not cope with people panicking, misunderstanding, they believe in this and that, in those, right? Reject it, accept that, right? So it's very relational situation. So we try to manage this. And we also work with other sectors to amplify the message and reach the broader audience. So we proactively go to the committee, to all sectors, to deliver the information. And they have 10 weekly online survey to understand the behavior and attitude in order to counteract the misunderstanding and something. So this is very informative, very good. And application of innovative approach to overcome COVID-19. It's not only technology, also how we work in the field. We have bubble and seal, with the different wave, we have different measures, to implement and coping with this. So this is how this one. And also the digitalization is good, but they utilize group among the people themselves, among the village health volunteer with the staff, and also they have a lot of application. We have picture of application to show you. And this is the review of the Thai health system response to COVID. This is, you could read later. This is the lesson learned, really kind of done by WHO, that Thailand success with the response because of the information for action is really well integrated. And we have protecting health worker and patient, we try our best, not only individual, but systematically or organizationally, we do that one. And we improve detection. So I think this is the opportunity for Indonesia as well to expand the surveillance and also laboratory and the kind of quality control to be standardized at the same level. And also we strengthen the workforce. So, not many of them are epidemiologists, those who have competency in laboratory. They have to do a lot of screening, but we have to train them, and we mobilize people from different areas to come to the kind of outbreak size. So that's sort of thing. We strengthening workforce, and we have world-class volunteer. I think start from the airport, right? And we have kind of surveillance, you follow them, right? So whatsoever we have to report. And when we have sign symptoms, when we do so, quarantine is very important and enhancing the coordination. So this one, if you talk about global health, we have like within the country, and we have like multilateral collaboration of ASEAN on many others. So this sort of thing is very important. So this is kind of you could see, we could talk it later. So this is, you could see like this is well presented and implemented to protect people, like distancing, right? So you could see that we could not hug, right? Or whatsoever, but we have to stay quite far. In Thailand, it's almost 2 meters, right? More than 1.5. And mask wearing, right now they're still wearing masks, you know. And you could see that everywhere, Thai people wearing masks. So my close friend from Japan, they said they could not believe that Thai people wear masks. And even, and the general people more wear them more than the public health personnel, you know. It's very funny, but for sure it's quite good that they learn. And hand washing, you know, normally people would not see that they have germs or whatsoever. They just said the surface is clean already, they could sit, they could touch, but after COVID, they consider it like there are a lot of like germs and microorganisms. So hand washing is important. Temperature checking, you know, they know when they got fever, right? They test first, right? They even said that they're okay, I'm not okay. So the Thai Chana is mean this is the application to follow and check, you know, check you with the authority that, okay, you start having this, and they will call you, supervise you and call you or whatsoever exercise. To this one is health promotion and get the lights off of news. And also in case of emergency, we have free medical service, EMS, you know, in Thailand, EMS is free, right? And also this one also institutionalized, not like the previous one is that people, right? And this one is clean and disinfect object and surface. Right now they still do it. Right after you leave your table, dining table, so people come and spray disinfectants and clean it. Normally we do it only one time, right? Before and after, but right now when people leave, they just do it. Provide 70% alcohol gel for you. You could see that everywhere still have this one. Every hotel and very this one. Restaurant table must be at least 1 meter apart. So we still kind of have this thing as sitting, you know. And the sign in all elevator and even in public thing, they could use it anytime. Limit the number of people in groups. So I think people now aware that this one is too crowded, right? So this one in business, all staff are required to wear masks. So everywhere they wear masks. They're still wearing masks. We sometimes, if in the public place, we wear, but if not, we also afraid of inhale of carbon dioxide, then we just like exhale back. So right, we try not to do it all the time. So we get like bigger space to do that. And we even have like recommendation for people visiting cultural site, because this is the place where a lot of tourists, you don't know where they come from. So in the third wave, you know, people went to the north and they go back to their home, but they not do shopping in the home, they come to my hometown almost the same day that I went there. So I was panicked also that, whoa, I might got infected because we went to the same thing. So this one is a recommendation for screening, for wearing masks or limited number, keep distancing, and this sort of thing is also kind of really fully function. And I think right now they're still doing it, right? So this sort of thing is very important. And this is the digital application they use in Thailand for tracking, right? We have away COVID-19, more Chana, Thai Chana. Chana is mean victory, so more is mean doctors, Thai and Thailand pass. And we have standard for setting. So this one, they have many things for from the Department of Health, Department of Disease Control, and also vaccination history. This one also, I got the vaccine and I showed to the immigration. I printed from this one. So it's still kind of, even they stop operate, but your record still there. And it could come back anytime. And in your assessment done by, this is the opportunity that you learn, and you, at the beginning, everyone developing it, right? You could not stop them, and you could see what work and what do not work, and the information you could use in the future. This is very important. This is our future as well, that we have to invest on this one. And then this is the thing that show that different proportion of the people under universal coverage. About 80% or almost 85% of the Thai are under universal health coverage that come from our tax revenue. So the 30 baht scheme, $1 per visit of the treatment, right? So, and then, but the overall also, the rest are by Social Security, the other one by civil servant, and all of this one get free service, free vaccine, and free kind of testing, and also many support. That is the thing. That's one. This one is a thing that what Thailand do. I think Indonesia, you also get the sort of thing free COVID-19 testing, free COVID treatment, medicine home delivery, pick up medication from community pharmacy, maybe 7-Eleven in the future, and after hours urgent care service. So this is the one. They have village health volunteer and team to visit them. This is the thing that we guarantee for Thai people. And then we also concern about the, how you call this one, the efficiencies, and also the well-being of professional stakeholders. So in this one, how could we improve their function? It's been, we have high level of political commitment that is very essential. So this one is really supported by the Prime Minister that show the strongly support. And we have robust health system that have been except for many decades to provide waste platform for an effective response. So with different levels, with different Ministry of Public Health, and also the higher education and other and private also do this thing. And we adoption the notion of whole of society approach and good collaboration between all sectors. This is, you could see how we have like Expediter Corp that we work hand in hand together, and we have very strong community network. So we have more than 1 million village health volunteers that work very effectively. So this one, we should promote, like actually village health volunteer work under the supervision of the public health personnel, but they run very well. And we have innovative solution to to the problem that encounters, right? Like for example, we do not have enough really hospital. We have cardboard bed. We have few hospital in school, in many sector, in health center, and even in the open space of how you call buildings of the community. And we have what we do like bubble and seal, because in the second wave, we have problem of migrant worker in factory nearby Bangkok, the Myanmar migrant workers. So we keep them safe in their own factory, and we support them, look like quarantine, but with a very healthy situation for living. So we could see that this is this is the minister actually to report to the Prime Minister, and this is the healthcare facilities and how village health volunteer work during COVID-19. Right? So some challenges for sure. COVID-19 is the largest pandemic in more than 100 years, with impact like internationally, right? At the global level, we call pandemic. And then, so this one is I try to link it, not only the disease, but it's really interrupt global supply chain, inhibit investment, interrupt labor market, like, and affecting the livelihood of millions of people. You see that many countries gone bankrupt, Sri Lanka, because Sri Lanka rely on tourism, right? They could not do anything. Laos and many other countries, even Thailand, we also suffering a lot because of this economic, and also the poverty rate have been increasing, so it affects more than 90 million people, and also we more than 100 million children. So it's kind of have problem of reading proficiency because they could not go to school, and even they could read online at home, study at home, so but they could not have equipment. So these sorts of things, this is have problem. And for sure, this is the tourism like that. You know, just during COVID, I stay in 5-star hotel in Phuket. It's only about $50 cheaper than Indonesia, like, and 5-star hotel, because by that time there is no tourists. So this one is affect our income a lot. So it affect SDG and everything. So all of the issue that really important. So this is, I think this you could really study in this kind of diagram, that work pattern showing impact of COVID-19, which is like, I think the kind of issue is the same, but the level and how it related with each other is different. Like high level impact, right? They have impact economic, like the infection and death, economic, and also many other things. Like, so we have to develop a lot of measure, both macro and micro, how in terms of health and healthcare. How could we reduce the poverty? How could we improve social protection, education, and protection against violence, exploitation, and abuse, and also nutrition. So this is something is very important. That is the good, really domain of you that you should consider. And one thing that I'm not pretty sure that I put that slide or not, mental health is post-traumatic stress is very important. That is really kind of looks simple, but it's really lasts very long for those who got infected and really severe, because this is stigmatization and right threatening, right? So there are so many issues happen, and for sure they have long-term isolation during social distancing, so it's caused a lot of depression. So this is the kind of what we try to do, because they have a lot of negative impact in terms of jobs, in terms of household income, loss, poverty, health, education, and nutrition, that we have to do it like before. But some positive impact is mean like disruption. So right now there are new how you call new job, right? People order food online, right? There are a lot of deliveries and many functions. So they change the economy completely, right? So how to operate, how to direct. Or right now our villager could really sell product online, you know, and then it's very good to develop the grassroots. So, and lesson learned. So the early success of controlling COVID is very good in Thailand. So that's why we thought that we could do it until it have Delta variants, and we know that we have problem already. So if with the restriction and the measure, it could not really cover, so we need vaccine. So Thailand was really slow to the vaccine at the beginning, but after that, after we we try to solve the problem of rejection of the vaccine, kind of like misunderstanding and thing, and then we try to develop healthy public policy to support the people and kind of make sure that we could really guarantee that they should get what they get, and we distribute and even deliver to provide vaccine to their home for those who live in the very far area, or there are vulnerable group like elderly or bedridden people. So this is the recommendation that we provide. So the first one that we recommend for global health issues in many countries, especially in Thailand, develop public health emergency preventive and control policy. This is very important. In terms of emergency, what should be done? So you should have the organization setting policy and do it very quickly and promote collaboration between different departments. Otherwise, you repeated the same thing, you wasted your time, and sometimes you even crash in terms of this one. And also not only response, also research study, conference and seminar to really kind of develop the knowledge. And also increase interdepartmental collaboration or cooperation. So administration, health education, communication, right? For sure, like Thailand, we send more than, I don't know how many million Thai people from Bangkok back home to their hometown. So how could we get the air-conditioned bus, right? So some province, they send the bus, like, and get the people back for free of charge, and like check them first, do community isolation and that sort of thing, and then they kind of do the thing. How could you do that? Raise the private sector involvement in public sector. So there are a lot of private sector that donate a lot of food, kind of give the money for transportation and many things. Expedite the development of a vaccine. This is very important with the support of the late King Bhumibol, King Lama IX, who really passed away a few years ago. He established the institution to develop vaccines. So Thailand have the intention to develop vaccine ourselves and going to be continue to really kind of manage the future pandemics and problem. Predict with public health measure would be most effective, and to keep the public updated with scientific information. How could we use big data now to predict for the future? And in case we have some event that really erupting, how could we foresee what is going to be? Information exchange for communicable disease by the WHO guideline with health inter-country communication for enhancement of country health system. Right now, like with the support of WHO, with the support of GTZ and many other, they try to develop international collaboration, multi-sectoral. How could we share the information and the guideline, and how we how you call this one, report case and respond. Development guideline for head of member of state, investment made for infrastructure, enhancement of legal framework and policy, and significant level of capacity building on public health emergency lead to minimize risk of inappropriate management of public health emergency. So this is very important to develop and have regular meeting and have guidelines and implemented it and prepare. So, and then the policy recommendation of each country. The first one, the strong leaders and collective leaderships for promotion and facilitation of regular committee activities. This is very important. The head of the state have to really kind of really commit and really kind of delegate the policy. Accurate and timely communication. There are a lot of issues happen because of miscommunication. So you have to use suitable channel and communication infrastructure that support by committee or external partner. So you could use any equipment, even application online or many other to provide regular and really correct or concise message. Collaboration and mutual respect, right? So you have to treat other sector really with respect, right? Local government and external partner play significant role in providing technical support, financial support, and public infrastructure. You could see that each province, each district, each area, they have like community, how you call committee that come from different sector. They might not be experience doing things together, but it's very successful. Sustainable multi-sectoral collaboration mechanism. So how could you use the mechanism is inclusive, right? Not exclusive. You have to include all sector. We call multi-sectoral collaboration practice in community. Is a lesson, is learning process that help community prepare for effective crisis and response. In my province, we have one big district that have population about more than 500,000, and they have a military camp, they have big many big factory, and also the big market and many other. So, and then in them meet, they committee, this all sector come together and they try to really share information, identify the problem and develop the measure together and really kind of communicate and implement. So they respect each other. So this one is mean the how we prepare for future, right? The first one, increase investment in digital technology and innovation. This is the first one that really important. I think Indonesia have done already, and what should be kind of whether you already over investment in some area, not cover other. I think you should really cover all area that is essential, right? Develop multidisciplinary workforce and implement effective strategy to prepare for next pandemic. So for sure, the next one will come, right? So, and then you have to define what the quality and quantity and distribution of workforce that really gonna really want to that one. Focus on health promotion among vulnerable people without discrimination. So actually, no matter what, whether they are elderly, they are kind of like chronic diseases, bedridden, but health promotion is important. If you have a good reserve, right? You are more likely to be fighting for this one, right? Right now, I'm 62 years old. Yeah, you could see my face. I'm 62 years old, and I still kind of go everywhere. Sometimes sleep 2 or 3 hours a day, but still kind of fighting, working, because when I have time, I have to do health promotion, right? I do not drink, I do not smoke, and that's something. That's one thing good, but I eat too much. That's my problem. So I have to manage. So this is the thing that you have to keep in mind, and you have to make that people, the vulnerable group have to be able to promote health, enhance self-reliance on vaccine, drug, test kit, and medical supply. This is very important. If vaccine is free, and how could, but transportation is not free, right? If you don't have any very good distribution, they have to spend a lot of money go to get it. And also, how about the drug, right? When it's virus, right? It's not really could not be killed. How could you really apply many techniques, like whether you have any traditional medicine that could stimulate the how you call immune, and it's really work very well with really kind of really you eat food as medicine, right? Not eat medicine as food. So test kit, how could be test kits is sometimes like you could not, you have to do it yourself. How could it's affordable, right? And also other medical supply. Affordable is very important. It could not be expensive, should be cheap, and at least all reasonable one. And develop more strategy and data integration. So for sure, you have to establish very good data management system, right? What data is needed, and how you assign different organization or different level, and how could you share it together and make use of it, not only for publication, but for management is very important. So, and then with the data strategy and then the data management, you could really gain a lot of things from this one, which is what we do with many other. Expand cooperation among related sectors to deal with issues such as infectious waste management. This is very important because like it have a lot of both solid waste and also like wastewater from hospital, from health promoting, or even the community isolation places and many other. So this one is, you have, first thing you have to make them know, aware that this solid waste is really infectious waste, not the normal waste. And also this wastewater from this area need to be treated before they use anything. The color may be clear or many things is clear, but actually there are a lot of germs and a lot of many how you call that one, component that's really harmful. Study best practice and learns from global pandemic response. This is very important. So that's why even among ourselves, I also go to many areas in Thailand to really filming and interview the best practice of different areas with different setting, like in the north, near the borders and many others. So this sort of thing is very important, and also we could really acknowledge those who really kind of contributes and really devote themselves. So this sort of thing. And the keyword for capture Thailand to respond. The first one is flexibility. You could not be rigid, and this is the policy, we have to do this. No, it depends on the context of the area. Adaptability, right? You have to make sure that people could really apply it and make it properly, and pragmatism. So this one is very important. So you have to learn from the real situation, being professional in the way that you respect, you open mind and collaborate with each other. So this sort of thing. And then this is what we do during crisis, during COVID. You see that people wear like this, you mobile the same as Indonesia. We are really similar, right? And like we have to wear like this, right? When we go to the community, if like really highly contagious, and when we take blood test, and this is vaccination. I got vaccination in the base hospital in Bangkok, because the ministry forced me to do, because I work with them and to grow with them nationwide. So they make sure that I have to have first vaccine first. By that time, I'm not really 60 yet. I have to get Sinovac, but I just tell them that I will go to Germany. So I got AstraZeneca. For in Thailand, you have to get when you are 60 years older. But I know that AstraZeneca is the best by that time for me. So I get 2 doses of AstraZeneca. And you see that this one still practices. Before you start like your kind of restaurant, and when people leaving the table, they clean it. Before, no, just one time before, one time after, right? So, and then like the table is very far, and in many places they still not really take this one out. And also people, they more likely to wear masks, right? And sorts of thing. They're kind of comfortable with it. Even me, I'm not comfortable, and kind of really the office. So work from home, study from home, and online classes and Zoom like we have today. And this is the new job, right? You have a lot of Grab, Panda, and many other. Even the elderly, they order things online, right? Normally I say don't order anything online, but right now I order food and many things I like online, especially the fruit pomelo from the south, right? Or selling thing online. So this is the opportunity for kind of that happened from COVID. Even we do blessing for elderly, they're still doing it. Even cooking or whatsoever, even among family members, for if any family, if you have elderly at home or children, you are more likely to wear masks all the time, no matter what. So this is something that I think still left, and you could see some pictures. So thank you very much. Yeah.
Okay, Ajahn, thank you for your presentation, Ajahn. It's true, Ajahn. After I stay in Thailand, Ajahn, for 1 year in Thailand, because in first year I take online course, Ajahn, and after in the 2022 I moved to Thailand until now. I'm very surprised, Ajahn, in 2 things, Ajahn. And the first one, no people smoking in the public area, Ajahn. It's true,
Yeah.
Ajahn. In public area, if any people want to smoking, usually they come to the toilet and etc. Ajahn. And the second one, until now, most of people and the student in Mahidol University using mask, Ajahn. Until now, Ajahn. And for me, usually I did not use the mask, Ajahn, but the Thai people is usually making the mask, Ajahn. And many if the government say A or B, and the Thai people is will to follow the instruction, Ajahn. I'm very surprised about that, Ajahn. Maybe on the Indonesian have to learn about that, Ajahn.
Yeah.
Let me to translate to the student and my colleagues in the UNISKA Banjarmasin, Ajahn. Let me maybe in the couple minutes, Ajahn. Oke, terima kasih untuk Bapak Ibu sekalian. Jadi ada beberapa hal yang mungkin menjadi titik poin oleh Ajahn Wongsa, yaitu yang pertama bahwa Ajahn Wongsa tadi mencoba untuk sharing bagaimana perkembangan COVID-19 di Thailand. Yang pertama, memang Thailand saat ini menghadapi yang namanya krisis orang yang muda. The young people is very low in Thailand, dan banyak orang yang sudah tua dan umur orang bekerja itu banyak, rata-rata umurnya 41 tahun di Thailand. Kalau Bapak Ibu ingin bekerja di Thailand atau kuliah di Thailand itu sangat besar sekali. Kenapa? Karena mereka membutuhkan orang yang muda. Terus selanjutnya adalah terkait COVID-19, bahwa di Thailand itu ada beberapa level untuk tempat seperti puskesmas, rumah sakit dan sebagainya, itu ada tingkatan seperti di Indonesia. Lalu selanjutnya beberapa prioritas di Thailand itu, yang pertama adalah bagaimana mencoba untuk membuat orang itu kembali bekerja. Terus yang kedua adalah bagaimana membuat orang itu kembali untuk bersekolah, dan yang ketiga bagaimana untuk meminimalisir orang yang riskan terhadap COVID-19, terutama orang yang sudah tua, seperti itu, seperti kepolisian, terus militer, terus elder people. Nah, itu bagaimana untuk meminimalisir COVID-19 seperti itu. Nah, beberapa challenges untuk COVID-19 itu adalah terkait banyak yang orang-orang yang bersembunyi atau yang tidak dapat dijangkau. Terus juga banyak gangster. Nah, seperti itu yang agak sulit untuk dicapai. Terus, namun ada beberapa kekuatan di Thailand, yaitu adanya dukungan dari senior. Artinya senior itu adalah banyak orang-orang yang sudah tua, tapi dia masih aktif untuk bekerja. Jadi di sini masih banyak orang-orang tua sekitar 70-60 tahun, seperti Ajahn Wongsa tadi sudah 62 tahun, tapi beliau masih aktif untuk ikut partisipasi menanggulangi COVID-19. Terus ada juga terkait strong health system, itu juga bagus untuk di Thailand. Terus juga, nah, beberapa hal yang dilakukan oleh pemerintah Thailand dalam menanggulangi COVID-19 di masa lalu adalah ada yang namanya CCSA, CCSA itu seperti tim satgas yang setiap harinya dia menginformasikan berapa COVID-19 di Thailand. Terus, nah ini yang kedua, ini unik. Di Thailand itu setiap 10 hari, 10 weekly, itu share the online survey. Jadi, share untuk survei online, itu terkait understanding, terkait pengetahuan terkait COVID-19. Jadi, ketika misalnya pengetahuannya itu meningkat, oh berarti bagus nih dalam promosinya. Namun ketika itu menurun, nah ini mungkin ada kenapa? Nah, ketika pengetahuannya itu menurun, maka akan sebuah tantangan gitu ya, seperti yang ditanyakan oleh Pak Ahmad Rizal, bagaimana terkait terkait peran dari tokoh agama dalam menanggulangi hoax dan sebagainya. Nah, kalau di Thailand itu diukur dalam 10 mingguan terkait bagaimana pengetahuannya atau pemahaman terkait COVID-19, apakah kemakan hoax atau tidak, ini terukur betul-betul evidence based. Terus di Thailand juga itu banyak aplikasi mungkin hampir sama seperti di Indonesia. Terus juga ada screening di airport, di bandara seperti sama mungkin di Indonesia. Terus tadi kalau di Thailand itu yang tantangan utama adalah ketika COVID-19 itu turismenya anjlok. Jadi karena Thailand itu tidak sekaya Indonesia sumber daya alamnya, maka turismenya itu is very decrease. Jadi karena COVID-19 turisnya pada turun. Maka sekarang pemerintah Thailand itu mencoba untuk how to increase the tourism in Thailand. Nah, dan ada kebijakan di Thailand itu 3 bulan yang lalu ada visa turis itu 45 hari. Jadi 45 hari visa turis, namun sekarang kembali ketika hanya 30 hari untuk visa turis. Terus, nah yang paling terpenting itu adalah Ajahn tadi mention about the post-traumatic after COVID-19. Jadi kita tidak bisa hanya sekedar berhenti sampai sini, tapi kita harus mengukur. Ini mungkin menjadi ide untuk mungkin mahasiswa di UNISKA, bagaimana mengukur post-traumatiknya terkait COVID-19. Mungkin dulu keluarganya ada yang meninggal ataupun ada terkaitan dengan COVID, bagaimana post-traumatiknya. Nah, terus Thailand itu ada 2 hal yang mungkin tak dapat ditemui di Indonesia. Ya, saya kurang tahu ya apakah sekarang di Indonesia semuanya masih memakai masker atau tidak. Namun di Thailand itu sampai sekarang semua memakai masker, karena ketika si raja atau pemerintah itu berkata A, maka orang Thailand akan A semua, tidak ada yang komplain. Kayak kemarin misalnya ada COVID-19 atau seperti apa, semua warung tutup semua, tidak ada yang komplain. Jadi semua istilahnya manut lah gitu yang ikut. Terus juga tidak ada orang yang
sami nawa atokna ya.
Nggih, betul Bu. Jadi ikut kepada pemerintah. Kalau di Indonesia kan yang penting pemerintahnya tidak zalim gitu ya. Yang penting kita bisa masih sholat, kita bisa masih tenang dalam beribadah. Jadi ya akan ikut dengan pemerintah seperti itu. Tapi kalau di Thailand juga seperti itu. Jadi tidak ada istilahnya kalau di Indonesia tidak ada orang yang yang melawan pemerintah. Kalau di sini tidak ada seperti itu. Terus selanjutnya, nah ini beberapa rekomendasi about the recommendation based on Ajahn Wongsa explain. Kita harus meningkatkan collaboration among sectors. Jadi tidak hanya public health saja tidak. Terus juga, nah ini develop vaksin, jadi mencoba untuk mengembangkan vaksin. Nah, berdasarkan dari bahan-bahan herbal. Nah, jadi dan untuk mengurangi oral obat yang langsung masuk mulut gitu. Jadi untuk mulai seperti itu karena kan mengurangi dengan yang kimia karena berkaitan dengan mungkin kerusakan ginjal dan sebagainya. Karena memang kalau berbicara masalah demografi, maka bagaimana membuat kualitas orang tua itu tetap sehat gitu. Nah ini mungkin tantangan juga di Indonesia. Nah di Indonesia ini yang ada yang katanya resesi seks dan sebagainya ini perlu juga dikaji ke depannya seperti itu. Oke, mungkin seperti itu garis besar yang disampaikan oleh Prof Wongsa. Jika ada Bapak Ibu ingin bertanya, mungkin kalau secara langsung direct speak in English is okay. Nah nanti mungkin silahkan Bapak Ibu. Kalaupun ada yang via chat is okay. Nanti jika ada yang ingin bertanya, monggo langsung raise saja. Okay, Ajahn Wongsa, I have explained about your explanation. Hopefully, is based on I explained based on your explanation and your PowerPoint, Ajahn. Hopefully, is true. Okay, Ajahn. Just I have I waiting for another participant to ask about this topic, and I have 2 questions, Ajahn. The first one and the second one. And the first one about the how about the religious leader, Ajahn, in Thailand to educate the people, Ajahn. Because for example, in Indonesia, many people believe to the leader, religious leader than the government leader, Ajahn. How about in Thailand, Ajahn? How about the Thailand with the monk and etc., Ajahn? Please, you can ask about the first question, Ajahn.
Yeah, thank you very much. Like actually the monk play a very important role because in Thailand, the monks are very rich because the money, people donate a lot of money to the very famous monk. So many hospital, many temple, many school is really kind of built by the money that given by the monk. Like even like sometimes the monk donate more than 100 million Thai baht, even 500 for the new one, the new college. So that's something. And then in the community, the monk really pleasing them in terms of prevention, like wearing mask, distancing, cleaning, and also the monk donate the money. And also like food, and also like you need like bed sheet, you need electrical fan for the community isolation that you have, because in the health center they don't have any bed, right? They have the second floor that really nothing to do except the meeting room, so they really kind of renovate or really kind of make it to be the bed and like facility. So the many monks donate these sorts of things, and in some community the monk really help organizing it and provide some service, like the monk given the money and support the local administration to work to support the people. So this is very most common that the monk really fully understand, and not many monks got infected. Most of the monk test and get vaccination, except those who are really very famous that I know some monk that's so really, how you call, highly respect and really kind of that's why he never got infection, he never stopped praising people, but never get vaccine, but he never get infected. So only few, but most of the monks follow the government policy.
Is the monk also actively participate Ajahn to educate the people Ajahn?
Yes,
Ajahn.
Yes.
because
very
very actively participate Ajahn to educate.
Yeah, they actively participate and conform to the policy and support the service to the people by donating a lot of money and support cars, support vehicle with equipment, whatever, food, and so many things that the monk support. Yeah, because the monk could raise a lot of money from many sectors.
Oke, Ajahn, I will try to translate in bahasa. Baik, jadi kalau di Thailand itu ada namanya apa ya? Kalau monk itu apa Bu namanya Bu ya? Bu, ya, jadi ada biksu ya, ada biksu. Jadi di biksu di Thailand itu mereka tidak punya rumah, mereka tidak punya apa ya? Tidak punya keluarga, ya tidak menikah juga. Jadi mereka di jalan ataupun di beberapa tempat umum. Dan mereka itu biasanya, sepengetahuan juga saya di sini, mereka akan menerima seperti uang dari orang, terus memberikan makanan, tapi setelah itu mereka akan mendoakan gitu. Nah, tadi saya tanyakan apakah actively participate to educate about the COVID-19? Iya gitu. Jadi ketika setelah mendoakan di sini biasanya langsung diberikan arahan, diberikan kamu harus pakai masker, kamu harus seperti ini, seperti itu. Karena memang seperti orang di sini sangat manut ya, sangat ngikut sekali dengan pemerintah atau mongnya tadi seperti itu. Karena mong di sini itu adalah segala-galanya gitu. Misalnya seperti kalau kita naik bis, kalau naik bis saya duduk di depan misalnya ya, saya duduk di depan bis, ada mong atau ada biksu, saya harus pergi ke yang belakang. Kalau enggak saya akan nanti akan diprotes satu bis nanti, kalau enggak pindah gitu. Seperti itu. Jadi mong seperti itu. Oke, mungkin Bapak Ibu ada yang mau bertanya kembali? Oke, sambil bertanya saya juga punya pertanyaan untuk Ajahn Wongsa. Ajahn, I also have the question, Ajahn. It's very interesting about the online survey, Ajahn. About the online survey 10 weekly. Is your mean about the online survey is through the Google form and who is the includes participant, Ajahn, about the online survey, Ajahn?
The online meeting, right?
No. Online survey about the to measure understanding people about the COVID-19, Ajahn.
They have like the speaker.
Speaker.
Committee, you know, Dr. Tavisin, the handsome one. Right now, he how you call? He been promoted to the Director General of the department in Bangkok. So every week, more than once a week, that the speaker of the committee really really announce and tell the situation, inform the policy, and if they have problem or whatsoever, they could really respond. So this one is the regular one. Like we used to have like every week that the Prime Minister talk about politics or something, but like during COVID, this is the representative, the speaker of the committee come out, and he's the one who responsible for many things. If people really get mad, they just bomb the speaker first, yeah, somehow.
Oke, baik. Jadi ini Ajahn Wongsa juga menjelaskan bahwa juga ada kalau di tingkat pemerintahan itu ada rapat mingguan, jadi dari berbagai lintas sektor untuk juga memahamkan. Jadi sejauh mana lintas sektor itu memahami terkait COVID-19 yang sedang dihadapi. Begitu Bapak Ibu. Oke, Bapak Ibu ada yang mungkin ingin ditanyakan? Ada yang ingin langsung direct?
Pak Purwa, there is a question in chat box from Siti Nurhaliza.
Siti Nurhaliza, okay. Okay, Ajahn, this is the one question again, Ajahn, from the Siti Nurhaliza, Ajahn. Ajahn, about what are the communication model, Ajahn, used by health promotion staff in order to minimize public understanding, Ajahn, about the communication model to minimize the misunderstanding, Ajahn, about the various policies related to the health based on Thailand. How about the communication model?
Yeah, so actually they have many models. The first one that they do is they proactively to inform the right information first, right? The correct one. So they go first. They say they go first and then inform them, right? And try to, and in case they have misunderstanding, they send this multidisciplinary staff to really correct the misunderstanding, right? So for sure, like many of the people, Thailand, Indonesia, afraid of the vaccine, right? So they kind of use different group of kind of health worker with a health volunteer to explain to them like the benefit and guarantee that if they have complication, how we're gonna deal with them. These sorts of things, this is how we do it. Like, and it's kind of, we said that it's flexible, right? It's adaptability. There is with different one, they do different thing, and it's come up with like message, they come up with pamphlet, they come up with video, they come up with many things to make people aware. And then there are a lot wrong information, false information to promote this, promote that. So we have the lie kind of the channel of lie that inform the people that this is fake news, this is the correct one, this fake news, this correct one, and something like I got call all the time because people claim about this and that. I said, this one, the Dean of the Faculty of Medicine of Mahidol University, Silat Hospital, will not say that something because he do not believe. He doesn't believe in that type of thing. So no matter what we inform, and sometimes like because we also look after the traditional medicine and they claim that this vegetable, this root or something that is good. So we said that is no proof and it's not come from our faculty. So we even make the video, right? So many, many don't who really claim, they have to make video to correct that sort of thing. Otherwise they will have problem with us no matter what. So we will not overclaim anything, but when we use something, some kind of herbal product might boosting the immunization, but not directly kill the virus or something. So that sort of thing we try to do that with the evidence and not overclaim anything. So this sort of thing that what happened all the time, right? And we do not really kind of waiting for them to come to us. We mostly proactively to really inform, correct about information and the understanding, aside from the kind of public medias and regular response and the information from application. Yeah.
Ya, Jan, I will try to translate in bahasa Jan. Baik, jadi untuk pertanyaan yang Siti Nurhaliza, jadi bagaimana model komunikasi? Sebenarnya sangat banyak sekali model komunikasi yang dilakukan di Thailand. Salah satunya adalah active communication, jadi komunikasi aktif di mana kita tidak menunggu orang itu untuk datang mencari informasi. Jadi bagaimana caranya pemerintah itu bisa komunikasi aktif, artinya kita yang aktif, tidak perlu menunggu orang itu untuk datang. Nah, komunikasi aktif ini biasanya melalui video-video, ya video-video yang disampaikan di media sosial ataupun disampaikan di berbagai media itu untuk menangkal fake news. Jadi misalnya kalau misalnya ada informasi yang fake, itu mereka jarang melalui tulisan, tapi mereka lebih ke video-video untuk langsung to the point seperti itu. Ini sepertinya Ajan Wongsa terlempar sepertinya Bapak Ibu. Sebentar. Ya betul. Ini Ajan Wongsa sepertinya sinyalnya sering gangguan.
Oh gitu.
Gitu. Kita tunggu dulu.
Iya. Tadi itu pagi beliau email saya, terus pas saya mau kirim ternyata beliau sudah join. Jadi, alhamdulillah. Iya.
Iya betul. Ini beliau memang ini Bu sinyalnya juga ini Bu, sebentar saja Pak chat beliau ya.
Oke.
Ada sudah
Sudah
kembali.
ada Pak. Oke, Ajan. I miss you,
Your
Ajan.
microphone still off.
Mute,
Your microphone still off, Ajan. Please.
turn on.
Okay, Ajan. Your microphone still mute, Ajan. Ajan. Okay, Ajan.
Please unmute me. Because okay, please unmute me because I don't know what's wrong with my computer, so I use my mobile. So you could ask me more. Yeah.
Okay, Ajan. Okay, Ajan. This is I have explained Ajan about the communication Ajan, and I have also question Ajan in the chat box Ajan is related with the Ajan. There are two questions, Ajan. From Asrinawati, was there any special help for the family who have a member pass away due to COVID-19, Ajan, and some kind of financial support, Ajan, for the family have who passed due to COVID-19. And the second one, what city in Thailand got the least number of people getting COVID-19 and why, Ajan?
Actually, like during COVID-19, we are not allowed to really organize any ceremony like weddings, coronation, or even like kind of how you call that, the funeral, right? So actually the budget we use is very small amount, like because you do it very limited numbers of guests who could join. And then normally like the community, they have the budget to support, like for example, normally they support each other, right? For this one, and the budget is even lower than normal because normally during Lily funeral, we have more than 500 guests or 1,000 sometimes if they are big events. So you use a lot of money to provide some food and like drink and that sort of thing, and some kind of ceremony like flowers and so on. But the COVID-19, with the nature of the kind of the spread of the infection, so that's why everything is limited, and they conform to the regulation. They have to wear masks, temperature checking, alcohol, and spacing, and many other things that really inconvenient. But if it's necessary, we go and we join. But very likely that they will inform us, or invite us. So mostly the budget that use is lower in the meaning. And then the other thing, all of like the authority like support them in all means actually.
Okay.
And then the second question, yeah, what is the second question again?
The second question is, in which city, Ajahn, the lowest COVID-19 in Thailand, Ajahn? For example, in the Khon or which city?
Some province. So some province that really kind of isolated, you know, the one that not the tourist destination, like some province in the how you call this one? Some province in the northeast and the north that are not really kind of really tourist destination close, like Nan or something, that people are less likely to go there, except that they are really how you call that one? They have objective, some objective. So there are something like this. So normally in different web, like my hometown Singburi is no case, but after that, because province in the central is very small, so within one hour you could go for full province already. So like people who went to Chiang Mai, the dot in our neighboring, the people in neighboring province of my hometown went to Chiang Mai and come back, and they go shopping in my province. So they start spreading the disease, but control very quickly. So that's sort of thing that happened. Mostly some small province in the north and in the northeast that is that have smaller numbers.
Small. Okay, I will try to in bahasa Ajahn. Jadi tadi Prof. Wongsa menyampaikan bahwa yang pertama terkait support. Nah, support ini jadi di sini memang antar keluarga itu saling support. Namun misalnya makanan atau mungkin dana untuk keluarga yang meninggal. Dan terkait yang lokal, jadi pemerintah lokal pun support, namun dia tidak mention apa bentuk supportnya. Terus untuk yang kedua tadi, daerah mana yang dia itu COVID-19-nya rendah, itu terutama di bagian utara, ya. Jadi bagian utara seperti Chiang Mai, Chiang Rai, mungkin Khon Kaen. Nah, dia itu memiliki yang rendah. Kenapa? Nah, ini ada kenapa? Karena provinsi-provinsi yang bagian utara itu tidak memiliki tempat wisata. Jadi dan di Thailand, the most COVID-19 ataupun COVID-19 yang tinggi kasusnya itu adalah tempat-tempat daerah wisata. Jadi misalnya seperti Bangkok, Pattaya dan sebagainya yang memiliki tempat wisata yang terbuka. Jadi memang resikonya itu adalah di tempat wisata, karena yang di bagian utara itu sangat kecil. In one question, Ajahn, in Thailand the medicine for COVID-19 is free or no, Ajahn? And how about the foreigner who studied work in the Thailand got the medicine and facilities from Thai government, Ajahn?
So actually the medicine is free, but they have like policy, like what type of medicine you get, right? So they normally the protocol is you get that antiretroviral, right? So that's sort of thing that recommended is all free. And then but for foreigners, it depends on the insurance you get.
Insurance.
Yeah, the insurance you get, that whether you get the social security or you get UC, but if it like that is also covered. And also, even though you do not really get, but this one is like this national security, like we have to treat you anyway, so for sure you will get it. So this sort of thing normally is no problem of getting the service, right? In the public sector one, right? So this sort of thing that is normally we give a lot of free service to foreigner, right?
Yeah. It's my like my experience, Ajahn. In my friend, he study in Mahidol, and usually university also provide usually have the hospital and university will provide the health facility as well, Ajahn.
Okay. Yeah, for sure. Yeah.
Ya, jadi Prof Wongsa itu menyampaikan bahwa untuk obat COVID-19 memang gratis, terutama untuk yang orang Thailand itu sendiri. Namun bagaimana dengan foreigner ataupun dengan orang asing yang bekerja ataupun yang belajar sebagai mahasiswa itu tergantung dari asuransinya gitu. Jadi orang di sini itu dulu ketika masuk Thailand itu ketika COVID-19 harus memiliki asuransi gitu. Nah, jadi sebelum masuk ke Thailand, seperti saya dulu sebelum masuk Thailand harus punya asuransi. Nah, karena saya mencoba untuk menghindari asuransi tadi, saya menunggu sampai Thailand itu free asuransi. Jadi ketika COVID-19 sudah mulai mereda, saya masuk Thailand tanpa asuransi, tapi di sini dikasih beberapa universitas itu menyediakan karena mereka punya hospital juga untuk melayani yang COVID. Oke, mungkin begitu. Ada lagi Bu Mei atau bagaimana Ibu?
Is there any time?
I think enough for this session.
Enough, oke. Oke. Okay, Ajan Wongsa, maybe the time is enough, Ajan, for this guest lecture and no question and no question for this time. And I'm very thank you for you to can join in this Zoom meeting. And please, maybe you have a closing statement, Ajan, and give for example, motivation for our student. Maybe because this is the bachelor degree, Ajan, here. Maybe you can also tell about the Khon or invite in your university, Ajan. Okay, Ajan, please the closing statement from you, Ajan.
Thank you. Actually, because I could not use my surface, I have to use my mobile, so I could not share. So if you would like to see what province that have less number of cases, you could go in some slides that like have to show different wave. We have the map of Thailand and the cases, the incident rate per 100,000 of the, you could see that a lot of province in the northeast, like, and the north is less have smaller number of cases. That's one. And also I will send a new one. So in this slide I include one pictures of the man. So he's the speakers of the COVID-19 managing committee of the government. So I will presented the slides like with adding some one pictures of Dr. Supasin, Dr. Tavisin. So he's right now is the Director General of the Ministry, Department of the Ministry. He got promotion after COVID-19.
Oke, thank you Ajan. Oke, Ajan menyampaikan sebetulnya ini sebagai closing statement beliau bahwa sebetulnya Ajan Prof Wongsa ingin menyampaikan beberapa gambar sebetulnya terkait ke provinsi mana yang rendah kasusnya. Namun karena beliau tidak komputernya sedang bermasalah, jadi beliau tidak bisa menampilkan itu. Seperti itu, intinya seperti itu. Oke, thank you Ajan for your presentation today. And now I giving back this agenda to the Master of Ceremony. Thank you from me, Ajan. Hopefully, I can meet you in the Bangkok or in the another place, Ajan, Indonesia, Ajan. Thank you, Ajan. Sawadee-krap, Ajan.
Very much.
Yeah. Okay. Alhamdulillah, our agenda is running well. Thanks 1,000 times for Professor Wongsa Laohasiriwong, our moderator, and all participants. Ladies and gentlemen, we finally come to end of today's agenda. Let us close the lecture by reciting Hamdalah. Alhamdulillahirabbil alamin. I realize that I can avoid the mistakes. I represent all committees of this event. Would like to say sorry if we have many mistakes. Those are agendas we have presented to you all this morning. We hope you learned something. Thank you so much for your attention. See you on the next occasion. Wassalamualaikum warahmatullahi wabarakatuh. Have a good day, everyone. Kapkun krap.
Thank you, Ajan. Kumkap, Ajan.
Thank you very much, Prof.
Thank you, Ajan. Thank you, Ajan.
May we still correspondence by email maybe for the networking?
Yeah.
Okay.
Yeah,
Thank you
please.
very much.
Yeah, thank
Okay.
you.
Thank
Yeah.
Thank you,
you.
bye-bye, Ajan.
Good afternoon.
Good afternoon, Ajan. Thank you.
Masya Allah, Pak Purwo mana? Pak Purwo sudah? Recording stop. Stop recording.